All right, let's jump right in. Look, if you're deep into pathophysiology, you already know it's not about just memorizing a bunch of facts, right? It's about seeing how it all connects, how a disease actually plays out in the body. So that's exactly what we're going to do here. We're going to visually map out the step-by-step progression of some major cardiovascular diseases. The goal? To give you a super clear mental model that you can just take with you right into your exams.
So here's our game plan. We're going to start with the venous system. Then we'll tackle the high-pressure world of hypertension. After that, we'll get a good look at how plaque builds up in atherosclerosis, see what happens when that leads to things like aneurysms, and then we'll wrap it all up with a quick-hitter exam review of the really key concepts. Okay, first up, the venous system. This whole section is about the journey blood takes to get back to the heart, and, what happens when that usually low-pressure system starts to break down.
So, we've all seen varicose veins, right? They're those swollen, twisted veins you can see right under the skin. But to really get what's going on and why it's a big deal, we've got to look deeper. We need to see the chain reaction that's happening inside the vessel itself. So what is the actual step-by-step process that turns a nice, smooth, working vein into, well, this? It's really a story about failing gates and pressure that just keeps building up.
It all kicks off with the valves inside our veins. Think of them like tiny one-way doors. When they get damaged, they don't shut properly. And what happens? Blood starts to pool up. We call that venous stasis. As that blood just sits there, the pressure inside the veins starts to climb, and that pressure stretches out the vessel walls. This high pressure then literally pushes fluid out into the tissue around it, and that's what causes edema. Let this dysfunctional cycle go on long enough, and it progresses into what we call chronic venous insufficiency, or CVI.
And this image right here, this shows you exactly where that pressure cascade can end up. This is a venous stasis ulcer. With CVI, the circulation is so bad that the tissues, usually down in the lower legs, are just starved for oxygen. This makes the skin super fragile, really vulnerable, and can lead to these incredibly painful ulcers. Okay, let's talk about another big problem in the veins, deep vein thrombosis, or DVT. Now, if there's one thing you absolutely have to know for your exams, it's the triad of Virchow. Think of it as the perfect storm for creating a dangerous clot. You've got three main ingredients. One, blood that's just sitting around, not moving. That's venous stasis. Two, some kind of damage to the inner lining of the vein. And three, blood that's just stickier than it should be, a hypercoagulable state. You get these things happening and your risk for a DVT just skyrockets.
All right, let's shift gears from the low-pressure venous side to the high-pressure arterial system and talk about hypertension. They call it the silent killer for a really good reason. It can cause an incredible amount of damage to your heart, your brain, and your kidneys long before you ever feel a single thing.
And the scale of this problem is, well, it's staggering. We're talking more than half of all adult men and over 42% of adult women in the US have hypertension. This isn't some rare condition. It is incredibly common, with some really serious consequences.
So to diagnose it and manage it, you've just got to know the numbers. This table shows the official breakdown from the American Heart Association. And notice the key word for stage 1 and 2 is or. That means hitting just the systolic number or just the diastolic number is enough to put you in that category.
This chart gives us that 30,000-foot view. The big idea is that a combination of your genetics and your environment can lead to dysfunction in two key systems, the sympathetic nervous system and the renin-angiotensin-aldosterone system. This creates two main problems: vasoconstriction, which means your blood vessels tighten up, increasing resistance, and your kidneys holding on to salt and water, which increases your blood volume. So more resistance plus more volume, that equals sustained high blood pressure. Now here's where it gets really interesting. We can zoom in on that RAS pathway. So you have the classical pathway. That's the one that makes angiotensin II and binds to AT1 receptors. He's kind of the bad guy. It causes vasoconstriction, inflammation, and all sorts of unhealthy remodeling. But there's also a protective pathway that involves ACE2. This one actually helps with vasodilation and reduces that remodeling. In hypertension, the whole system is out of balance, with that bad guy, AT1 pathway, running the show. And the long-term results of that constant, unrelenting pressure is just devastating. The heart muscle has to work so hard it thickens up. The vessels in the brain get weak, the tiny, delicate filters in the kidneys get wrecked, and even the blood vessels in your eyes get damaged. This is a perfect example of why we call it a systemic disease. It hits the whole body.
Next up, let's talk about atherosclerosis. And you can just forget that old idea of your pipes getting clogged up with grease. That's not really it. We now know this is a chronic inflammatory disease, and it's the root cause of heart attacks and most strokes.
This one image pretty much tells the entire story of how a perfectly healthy artery can turn into a ticking time bomb. So let's walk through this progression, step by step, from the very first injury to the final catastrophic event.
Okay, so the whole cascade kicks off with some kind of injury to the endothelium. That's the delicate inner lining of the artery. That injury triggers an inflammatory response, which leads to something called a fatty streak. Over years, that streak grows and hardens into a fibrotic plaque. But the most dangerous part is stage 4, the complicated lesion. This is where that plaque becomes unstable and ruptures, triggering a blood clot, a thrombus, that can completely block off the artery.
Let's really zoom in on step 2, the fatty streak, because this is key. LDL cholesterol, the bad cholesterol, slips through that injured lining into the artery wall. Once it's in there, it gets oxidized. Now, this oxidized LDL is like a giant red flag for your immune system. It calls in these cells called macrophages, which come in and just start gobbling up all that oxidized LDL. These big, bloated, lipid-filled macrophages are what we call foam cells. And when you get a bunch of them together, you've got yourself a fatty streak, the earliest visible sign of atherosclerosis.
Okay, so now let's see how all this damage can lead to major structural failures in our arteries, like weak spots that bulge out or sudden blockages that just cut off blood flow completely.
For any exam, you absolutely have to know the difference here. A true aneurysm is when the artery wall itself balloons out because all 3 layers have become weak and stretched. A false aneurysm, well, it isn't really an aneurysm at all. It's actually a leak from the artery that's being contained by the tissue around it. It forms a little pocket of blood, a hematoma, right next to the artery.
And this slide gives you a perfect visual of that difference. See on the left, the true aneurysm is an actual outpouching of the vessel wall itself. But on the right, with the false aneurysm, you can see there's a break in the wall and the blood collection is happening outside of it. They might sound similar, but they're 2 totally different structural problems. Okay, time to bring it all home. Let's consolidate everything and really lock in the most important causal chains, the stories you need to be able to see in your head during your exam. All right, let's boil it all down. These are the core stories you need to have locked in. For varicose veins, just think bad valves. It's a mechanical problem that leads to a pressure problem. For hypertension, it's a system-wide failure, right? The hormones and nervous system go haywire, which cranks up pressure and volume, and that just hammers your organs. And then there's atherosclerosis. That's an inflammation story, starting with an injury and fueled by lipids, all leading up to that final dangerous clot. Mechanical, systemic, and inflammatory. You know, if you remember only one thing about atherosclerosis, let it be this. It is not just a plumbing issue. It's not just about high cholesterol clogging up a pipe. From the very beginning to the very end, it is an inflammatory disease. So we've just walked through how one thing leads to the next, which leads to the next. You can see the whole cascade. And that leaves us with a final, really critical question for when you're thinking like a clinician. If you can see that whole chain of events, where's the single best place to step in and break the cycle? Something to think about.